Run a committee hearing with your talents there. Okay. Okay, good afternoon, everyone. Thank you for joining us. We appreciate your participation sort of late in the afternoon on a Tuesday. I'm Kate Knox. I am working with the Campaign for Tobacco-Free Kids this session, along with Laura Harper and a whole bunch of other people you probably know. We wanted to take some time this afternoon to offer you just a really important perspective on the intersection between menthol cigarettes in particular and race and the African American community. So we have some fabulous guests here. I'm gonna just kick it over to Representative Meyer and Representative Talbot Ross, who are taking the lead on this issue in the legislature. We'll talk about their bills in a little bit, but let them introduce themselves and get us started.
Thank you, Kate. Happy to be here today. I am Representative Michelle Meyer. I serve in my second term representing Southern Maine's House District 2, which is Kittery, South Berwick, and all of Elliott. And I'm very happy to welcome my fellow legislators, advocates, a panel of experts, and interested others here today for a presentation and discussion around legislation. Both Representative Rachel Talbot Ross and I will be bringing forward this session in an effort to strengthen tobacco policy here in Maine, and in doing so, addressing the health disparities that exist resultant of the tobacco industry's decades-long marketing tactics targeting the African American community. I come to this issue as a healthcare professional. I'm an RN, and as a parent and a grandparent aware of the tobacco industry's predatory practices, and seeing the opportunity as a legislator to come at them head on in an effort to save lives. My bill will end the sale and distribution of all flavored tobacco products without exception and across the product line. And Representative Talbot Ross will do the same within the context of a broader health equity omnibus bill. Neither bill has come out of the revisor's office as yet, so I don't have any LD numbers for you. Tobacco kills more people than any other addiction, and we know this is an addiction of adolescents, with the majority of smokers starting in their teens with flavored tobacco products, menthol, mint, candy flavors, making it easier for kids to give tobacco and vaping a try and making it infinitely harder to quit. The tobacco industry has a lengthy history of targeting people in Black and Brown communities, and to date, they have had resounding success. It's no accident that nearly 90% of African American smokers use menthol cigarettes, and that population suffers the greatest burden of tobacco-related mortality of any ethnic or racial groups in the United States. So the aggressive use of flavors and predatory marketing tactics coupled with the under-regulation, including a menthol loophole in many states, has played right into the tobacco industry's strategy to addict generation after generation of Black and Brown people, robbing them of the potential for a full and healthy life. And that is a huge part of my motivation in sponsoring this bill. And it's with great pleasure that I introduce my colleague, Representative Rachel Talbot Ross.
Well, thank you so much, Representative Meyer. I am truly honored to be here today with you and to all the distinguished speakers. Want to also welcome my colleagues and those who are joining us today who care about this issue very, very deeply. I represent House District 40, which is part of Portland, and am pleased to be serving my third term in the Maine State Legislature. With a focus on looking at systemic racism and addressing health disparities and racial equity in our policymaking. I had the opportunity, I'm pleased to say, to hear our keynote speaker, Delmont Jefferson, speak to a group of Vermont legislators a few months ago. And I knew then that I wanted to join with others to bring him here to Maine so that we could all benefit from his powerful message and leadership. I'm honored to join Representative Mayer in sponsoring legislation that is, as you have said, long overdue, a long overdue focus addressing structural racism and racial health disparities. From a public health perspective, there is no question that strong tobacco control policy is central to our ultimate success. As you have stated, Representative Mayer, African Americans suffer the greatest burden of tobacco-related mortality of any racial or ethnic group in the United States. For more than 60 years, the tobacco industry has deliberately targeted the Black community, especially our youth, with marketing for menthol, cigarettes, and other tobacco products like flavored cigars. Now, Black Americans are being disproportionately impacted by COVID-19, and the Centers for Disease Control and Prevention have found that smoking increases the risk for severe illness from COVID-19. We know that the devastation of tobacco use on health and productivities of Black Americans is no accident. It is the deliberate, intentional result of the tobacco industry's long history of targeting the Black community with menthol cigarettes. So we all have a responsibility to end this injustice. And I am, again, really, really pleased to be here with you today to join Representative Meyer in this legislation. And I look forward to the conversation moving forward. Thank you all for being here today.
Thank you both so much. That's helpful perspective and a great place to get us started. We'd like to start by asking Dr. Ann Coates, who's a pediatric pulmonologist here in Portland, to just give us a little tutorial on menthol and nicotine addiction, and just sort of ground us in some scientific facts, if we could.
I would be delighted to. Thank you, Kate, and thank you all so much for this opportunity to speak today. As Kate mentioned, my name is Annie Coates. I'm one of 4 pediatric pulmonologists here in Maine, and I am passionate about educating our youth and our communities about the harmful effects of flavored tobacco products. As my colleagues have mentioned, the focus of today's briefing is specifically on menthol flavored tobacco products and the destructive impact it has had on the African American community in particular. Menthol is a commonly used chemical primarily derived from peppermint or cornmeal plants. It has multiple different medicinal properties, the vast majority of which are not why tobacco companies add it to their products. Instead, they're capitalizing on its local anesthetic properties, which effectively numb or cool the respiratory tract, especially the nose, the mouth, and the throat. Menthol also suppresses the cough reflex and possibly dilates the bronchi, or the small airways within the chest, and enables a deeper inhalation and tolerability of inhaled smoke. Furthermore, studies have shown that menthol cigarette smoking results in a slower nicotine metabolism or breakdown, and lower total nicotine clearance in the body, which results in higher levels of nicotine in the body. Ultimately, this leads to higher nicotine dependence and therefore greater difficulty in quitting. As Representative Talbot Ross mentioned, approximately 90% of African American smokers use menthol cigarettes, and that is no coincidence. Menthol also appears to alter the cell membranes throughout the body, resulting in greater potential for tobacco-related deaths, specifically from heart disease, cancer, and stroke, which are the 3 leading causes of death of African Americans in the United States. This is entirely preventable. So as a pediatric pulmonologist, as a mother, As a resident of Maine who has dedicated my career to the health and well-being of our communities, please use your voice, please use your vote, and please support this critical legislation. The well-being of our youth, the African American community, and other minorities depend on it. Now I'd like to introduce my colleague, Dr. Edwards, who will discuss the negative impact menthol tobacco products have had on oral health. Thank you.
Thank you, Dr. Coates. And thank you, Representative Talbot Ross and Representative Meyer. I am Florence Edwards. I'm a local dentist in Southern Maine. Before I was a dentist, I was a child who weekly read Jet magazine, a publication most descendants of American slavery have in their home. Jet is a Black or African American periodical that documents pop culture. There were always full-page ads of beautiful Black people smoking menthol cigarettes. It wasn't until I was older that I learned that the said propaganda or advertising was promoting the most addictive and deadly form of tobacco, which is menthol flavored tobacco, to brown and Black people. Menthol as a flavorant damages gingival epithelium, AKA gums. These damages are 1, preventing cells from arresting irreversible growth, 2, increasing inflammatory responses, 3, it alters cell membrane by increasing cell permeability, and 4, it increases DNA damage, which dysregulates repair as inflammation becomes favored. These harmful side effects inhibit the mouth's ability to fight infection and replenish connective tissue, which leads to higher risk of gum disease and tooth loss. The FDA Tobacco Products Scientific Advisory Committee report recommends removal of menthol flavored tobacco products from the marketplace because scientific evidence establishes that menthol as a characterizing flavor in cigarettes is harmful to public health. The American Dental Association reiterates why menthol should be eliminated for 3 reasons. Menthol increases the number of children who experiment, then become regular smokers. Menthol increases addiction and reduces smoking cessation as it disproportionately harms the health of Blacks and worsens the existing health disparities. And 3, it could potentially cause significant numbers of current menthol smokers to quit. Thank you for your time. And next is our keynote speaker, Delmonte Jefferson.
Well, thank you very much. I appreciate that warm welcome and introduction. I am pleased to be here speaking to you folks in Maine on this very important issue. I am going to share my screen so that we can look at a nice little presentation that we put together just for you here in Maine. So let's get to sharing our screen. I think it's desktop number 2 and share. Okay, I am the executive director of the Center for Black Health and Equity. We used to be called NAPTN, the National African American Tobacco Prevention Network, but we started doing a little bit more than just tobacco, so we changed our name last year. The center is one of the 8 CDC-funded national networks that we work with community-based organizations and national partners. And what we try and do is we just try and make sure that tobacco control activities and policies benefit communities and people of color. There are 7 other network siblings. They work across the LGBT population, the low SES population, the Asian population, Hispanic population, behavioral health, mental behavioral health, national Native American population, and then those in geographic areas. We build community capacity. We try and make sure that our communities are able to advocate for the policies that are going to benefit them. We try and address the intersection of health and social justice and economic empowerment. We make sure that we partner with both the traditional and non-traditional African-American civic and community-based organizations. And one thing we want to do, we always want to hold systems accountable for developing equitable solutions, not just solutions because they look and feel good. And so, as I said, our work has expanded. We look at other core influences on African American health, the economic, institutional, social justice, inequalities, and we utilize our platform to mobilize our stakeholders around these issues impacting our communities. And so, why tobacco? We've heard put earlier from our speakers and even our representatives, each year, approximately 45,000 African Americans die from a preventable smoking related disease. We talked about it, heart disease, stroke, and cancer. So since June of 2000, what we've been doing is working to reverse this burden by building, again, the capacity of our communities of color. There was an article that came out, this was about 2-3 years ago, it just talked about Black children still suffering more. It's time to do something about it. So think about this. Even though more than half the country is covered by smoke-free laws, Black children were still suffering from secondhand smoke. And so even though we have policies put in place, we address secondhand smoke, we say we ban flavored tobacco products, Black children are still suffering more. Black people are still suffering more. So we have to make sure that these policies that we put in place are equitable policies. We don't want to do just flavors. We want to make sure that menthol is included because, again, people who are suffering the most can't be excluded from these policies that we're putting into place. And when we talk about, and we heard talk about the targeting of African Americans with menthol, if you go just back 50 years ago, or a little bit more than 50 now, in 1953, African Americans only smoked menthol at 5%. And then if you look at how that number had more than doubled in 1968 and then tripled in 1976, and in 2006, it was at 88%. And right now, as we heard, we're at over 90%. 90% of African Americans who smoke mentholated tobacco product. This is not by accident. 90% smoke mentholated tobacco products. And if you look at just in general, the party populations as a whole, African Americans, Asians, Latinos, all smoke more than whites. Now that's very interesting. You say, well, why is that? Well, the targeting, you think about the targeting, where the advertising are. Like we look at this Newport Alive with Pleasure advertising. That advertising is for African Americans. You don't usually see Newport Pleasure that have white people in the ads. That's usually an African American or another person of color in those ads. We heard Dr. Edwards talking about the Jet magazines and those publications. Well, this assault on African American communities was or is still is systematic and it's intentional. Targeted television advertising, the Ebony and the Jet magazines, the community philanthropy, which is a really big one, the cool jazz festivals. And I will admit, when I was younger, I was even hooked into those cool jazz festivals. I used to go to them. I used to attend them, and never once did I know that the purpose of them or the sponsor of them was the tobacco, to get us hooked on tobacco. But as I thought about it later, I do remember the cigarette sampling vans at all of the cool jazz festivals, those white vans, and they were green and white, and they were giving out cigarettes. But it didn't occur to me to say, oh, I saw the cool sign, but I always associated the cool with it being, oh, it's a cool thing to do. It's just this cool festival. We got jazz going on. Never did I say, oh, well, this is a cigarette brand and that's what they're trying to get. But that's exactly what they were doing the whole time. They were conditioning our populations, the community philanthropy, giving away to our events. Tobacco industry was sponsoring when nobody else would sponsor. They were sponsoring community events, festivals, donating to churches, church officials, elected officials, when no one else was doing this. In fact, it was R.J. Reynolds in North Carolina, Winston-Salem, that actually had hired a whole slew of executives. So not only did they hire African Americans to work in lower positions, but they also hired African Americans in executive positions in Winston-Salem, North Carolina. Again, putting out goodwill towards our community. And even to this day, it's very hard to disassociate African Americans with what's happened, because what they'll say is, tobacco paid for my kids' college. Tobacco paid for my mortgage, or tobacco did all these things for me that were good, and they forget about the ill effects, the health effects that tobacco has caused. So, our organization has a big focus on menthol, and people say, well, why do you focus on menthol so much? Well, we focus on menthol because menthol is focused on us. For decades, menthol is focused on Black communities. It has focused on communities of color. It's focused on young people. We saw this Surgeon General's report that came out in 2012, and it was amazing. This was just a few that we pulled out, but it was littered with all these things about menthol and how its flavoring increases the addictive potential of smoking among youth and young people, how the flavor additives, including fruit and candy flavors, they were used as marketing tools to attract young smokers, how menthol cigarettes more likely to be marketed in stores and in schools with a higher proportion of African-American students. We had that data. We had data from Brown and Williamson's executives that actually one of them left the industry when they saw the targeting that was being done, and they came to work for our organization, and they just shared with us that there were focused communities and non-focused communities. And the focused communities were communities that were, they were more urban. They were, of course, they had more African-Americans or people of color. These were focused communities. And then you had non-focused communities that were rural and were more white. And in your focused communities, advertising was greater in focused communities. But the thing that's really, really deplorable is that the cigarettes, a pack of menthol cigarettes, was actually 50 cents or so or more cheaper than in a non-focused community. So not only did we advertise more there, but we made the product more affordable. And so this is predatory marketing at its finest. And we think about even today, and we think about the number of flavors that are out there. 15,000 flavors that are used, of course, to draw kids to e-cigarettes and or tobacco products in general. And then the nicotine just hooks them in. The tobacco industry is a very, very vicious group. They have preyed on our communities. They continue to prey on communities. This is not new. This is not something that they just started doing. They just saw that this was a good market. They've done this for decades. Even back in the late 80s, early 90s, Uptown Cigarettes, there was a cigarette that was just for Black folks, just for Black folks. Reynolds, they targeted a Philadelphia Black community in 1990 for this launch of Uptown Cigarettes. Coalitions and groups, members that were part of our organization at that point in time, they heard about this and other health groups. They started saying, no, this is not something that we want in our communities, and you can take this away. And there was marching, there was organizing, there was protesting. The Secretary of HHS, Louis Sullivan, they called out R.J. Reynolds, and Reynolds eventually withdrew the Uptown cigarettes. And this is what a picture of the Uptown cigarettes looked like. They had the black and the gold. They had the advertising with the African-American people. But we said, hey, not the time, not the place, not our communities. We don't want this. And so this wasn't new. They didn't stop there, though. They didn't say, oh, you don't want it now. They came back later. They had another event. And these are just a couple that I'm sharing. There were others. But we probably remember the Cool Mix campaign that came out in the early 2000s, an attempt to capitalize on hip hop in the Black community. And they had these nationwide mixing contests and scratching and DJing, all things that were happening that were popular in our communities. And there was a local opposition. Again, our group was part of the local opposition, and we even helped to bring a lawsuit along with attorney generals of New York, Massachusetts, Illinois, to block this national meeting that they were going to have up in Chicago with this contest. And here's just what those packs of cigarettes look like. It was incredible. These are 4 separate packs of cigarettes, 4 separate ones that you were supposed to collect them all. And if you collected them all, you could win a prize for collecting this. And as you can see, it's one whole image with the DJs, and they're scratching and they're hip hop, they're dancing, they're at a club, and it's fun, and it's all Black. But this was targeting. This is predatory marketing of these communities. And so we had to, we fought it back, and we were successful in fighting it back. The same old thing again, this is not their own. Back in the days, they used our own preachers, our own platforms against us. In 2009, when menthol was excluded from the Tobacco Control Act and it remained on the market and they banned all the other flavors except menthol, we had African American organizations saying, hey, Black people want to smoke and Black people like to smoke menthol. So you shouldn't ban menthol and exclude menthol because this is what Black people want. Well, that message didn't come from Black people. That was a message that was sponsored and paid for by the industry. Reynolds American International, RAI, Reynolds American International, is the group that sponsored it. It's the group that paid to the Reverend Al Sharpton and the National Action Network. And they've been going around the country with this message of, hey, look, if you ban menthol, you'll wind up decriminalizing the Black community. And so don't ban menthol cigarettes. And they go from church to church and they'll get a group of pastors together and congregation members and have this message. This particular event that happened up in Minneapolis, Minnesota, back in 2017, I happened to be in Minnesota at that point in time. And when I found out about this, we looked around, we talked to our different coalition members, and we happened to have one of our members that actually attended this church that connected us with the pastor, Pastor Billy G. Russell. And so I asked him, we met with him, we sat down the day before the event and said, hey, look, this is what they're trying to do. They're trying to spread this false propaganda. Could you give us an opportunity to do a rebuttal? And he said, absolutely. I didn't know that that's what this was all about. I thought that this was something legitimate. So he gave us a chance to do a rebuttal. And let me tell you, it was interesting because when I was there to give them a rebuttal, they didn't stand that well on that platform, because one of the things that I asked them as they talked about how if you banned menthol, it's going to allow for more African-American young men to have these negative encounters with policemen and be arrested. One of the things I asked him was, do you have any data to support this? And the answer was no, because of course, there's no data to support this. We had already at this point in time banned other flavors, strawberry, grape, all these other flavors were banned. So I said, well, wait a minute, since 2009, we've banned strawberry, grape. Has there been any indication that African Americans were arrested more for possessing strawberry, grape, or other flavor? And the answer was no. So they didn't have any data. However, this was a message that RAI International, by the way, who sponsored this event, paid for them to host the event, paid for them to get the food and put it together, paid for their travel to get there, was having them to promote. And they continue to promote these messages to this day. And so again, we would just warn you to look out. But it's very important that we talk about this because, you know, what we do is, and what we don't want to do is we don't want to give this opposition messaging. We don't want to give Al Sharpton this platform to argue about how, you know, banning menthol could lead to the Black people, Black New Yorkers being targeted and harassed by cops. You don't want to give them that opportunity because I will say, on the surface, that looks like a good argument because Black people, if they know one thing, they know that young men do get harassed and targeted by cops. They know that. And so when you say, hey, look, they could be harassed and targeted because they're having menthol, you know, there's this unfairness. There's this obvious point, and this is coming from Guy Bentley. He's one of the folks that works at the Reason Foundation, that the criminalizing of the sale of an addictive and profitable product will lead to the over-policing of Black neighborhoods, not to protect them, but to target them for these types of crime. We know, you and I know, that when Black people are targeted, it does not have to be because of a cigarette. It does not have to be because of a mentholated tobacco product. They will be targeted for any reason. They are targeted because of policies that allow police and others to target these populations without any consequences, And so that's why they're targeted. However, they get this argument if we don't look at how we're enforcing this policy. If we've got a policy that bans the sale of mentholated tobacco products that have been plaguing our communities, we have to make sure that there's equitable enforcement. We have to make sure that there's equitable enforcement because we don't want instances like Eric Garner, Sandra Bland, or George Floyd, you know, things that they have in common, aside from being all Black, of course, all three are Black, but all three were murdered by law enforcement. That was another thing that they have in common. What you may not know is that their encounter with law enforcement for each one of them was related to tobacco. Eric Gartner was supposedly selling Lucy's. But they really, Lucy's wasn't the real reason why he killed. He was killed because he was Black. Sandra Bland, when she was pulled over, she was smoking a cigarette and she didn't put it out when the officer told her to put out her cigarette, which led to her being arrested and then dying. And George Floyd, of course, who can forget the horrible incident last year when George Floyd was arrested and was murdered on national television? Well, his encounter was because supposedly he had purchased a pack of Newport cigarettes, mentholated tobacco products, with a counterfeit bill. And that's how come the law enforcement was called on him. But the murder of him had nothing to do with the Newport. So we just have to be careful with our enforcement because we don't want additional situations like what happened to these individuals. We know what it could lead to. We know what it led to. But again, it led to these because there was not equitable enforcement. So not only do we have that we have to address, not only do we have to address unfair targeting of minority populations, of Black and brown people, we have to address unfair enforcement, or we have to address what we want to call, what we'd rather call, equitable enforcement in tobacco control. Some of the recommendations we put together this, how do you do equitable enforcement? So if you're in the state of Maine, how do you make sure that the enforcement is equitable? And some of the key recommendations that we came up with, of course, the enforcement of this, because this is a public health issue. This is a public health issue. We're trying to stop the selling of mentholated tobacco products. And so we shift the enforcement from police or traditional law enforcement to public health or non-public health entities. We want to direct the funding to health entities to support tobacco prevention and control efforts, including efforts aimed at the social determinants of health. How do we make sure that when we get this funding for tobacco control, how do we make sure that it goes towards looking at some of the factors why people are smoking in the first place? Are you smoking because of stress? Are you smoking because you're out of a job? Are you smoking because of your housing environments? Well, how do we address with tobacco control funding some of these social and political determinants of health that may be catalysts for people smoking in the first place? How do we make sure that we eliminate possession loss, purchase and possession loss? How do we eliminate those and keep the focus on the retailers? But again, we don't want to penalize the individuals and the retail clerks that's selling it. We want to look at the store owner that allows the selling of these tobacco products to happen. So nothing should be punitive, but a more of a restorative justice approach. So in closing, menthol, as we know, and as we've heard, it's a social justice issue. Not banning menthol is really an example of systemic racism for obvious reasons. And unequitable enforcement exacerbates the problem. We've got to focus and we've got to be clear that when we're looking at our legislation, not just in Maine, but as a country, we love what you guys are doing in Maine. We love what happened in Massachusetts. We love what happened in California, but I will just ask you to be wary because even in California, even now, after we had this wonderful law last year and we were glad and we celebrated, the tobacco industry hasn't stopped. The tobacco industry didn't take a day off and say, oh, all right, we lost California. No, that they're still trying to overturn what happened in California last year through a referendum. And because they've got this thing where they're looking to possibly recall Governor Newsom, there's a potential that in November of this year that this restriction, this menthol and flavored sales restriction could be on the referendum again in November. And so the tobacco industry hasn't given up. And why haven't they given up? They haven't given up because menthol, they know is key to their industry survival. Menthol is a potential in-game strategy for the industry. And why is that? Because menthol is in every single tobacco product. It may not be in there at the level where it becomes a characterizing flavor like Newports or Salem. It's not at that level, but there are trace amounts in it for the same reasons that we heard earlier. It masks the harshness of the tobacco. And without menthol there in these products, it would be almost impossible to smoke without it being so harsh. Nobody would like it. So there are trace amounts of menthol there. The tobacco industry knows it. And so they haven't stopped. And so they haven't stopped advertising in focus communities, and we just have to make sure that that quits. We have to stop any type of price discounts, which is completely predatory in focus communities. Of course, I think we've made progress on the cigarette sampling bans. In this country at least, but overseas, they still have that as an issue. We've got to eliminate donations to African-American organizations and elected and or church officials, and as well as the sponsorship of African-American community events. But it goes even a step further. These industries are getting slick with this. They are trying to position themselves as corporately responsible. They're trying to say, hey, look, we recycle. Hey, look, we use recyclable materials. Hey, aren't we doing so good? Hey, look at our hiring practices. We're hiring all types of populations. There's no discrimination. They are actually trying to position themselves, regardless of the fact that they're selling a product that's killing, that will kill 1 of every 3 people that use it. They're trying to position themselves as corporately responsible. And if we don't be careful, they could get away with it. And so we just have to be careful and watch them. They're even trying to position themselves as being on the forefront of the youth tobacco prevention movement, that we don't want kids smoking and using our products. And so we just have to be careful. And then, of course, we have to look at unequitable enforcement of commercial tobacco control regulations and policies to make sure that we're enforcing this public health issue with public health personnel. And that is all I have for now, the end, and this is my contact information. And I will quit sharing my screen. There you go. Thank you.
Thank you so much, Mr. Jefferson. That was so helpful. I wonder now if Representative Talbot Ross and Representative Meyer could just take a minute to give folks the details of their legislation. If that's possible.
Do you want to go first, Representative?
She's
Meyer?
got yours. She's got yours up, Rachel. Why don't you dive in?
Let's see. Oh, I see. Yep. So I've got a bill that builds off of a lot of work that's been happening over the last couple of years. LR 1927, as you've heard, it's still in the revisor's office. An act to advance health equity, improve the well-being of all Maine people, and create a health trust. What at the heart of this bill does is it bans flavored tobacco products, as you'll hear from Representative Meyer as well. We want to make sure, for all of the reasons that you've just heard and more, that we get this out of our communities, and we turn our attention into prevention and treatment, education, and outreach. So this bill will, in addition to banning flavored tobaccos, we are also looking at a data collection component of the bill, improving our data collection and analysis and reporting, particularly having that data collection and analysis co-led by people in the community who are most impacted and experiencing the health disparities. That many of you are familiar with LD2, in which we just passed, that looks at racial impact analysis statements. This would be an area in which we would produce that kind of a data to understand the racial impacts and health equity issues. As Dalmonte just eloquently presented nationally, we need to do a little bit more. We have to do much more to understand the impact here in our state. The bill looks at enhancing health improvement and health equity planning at the local and district and state levels in order to do just as Dalmonte has said, in order to confront systemic racism. The bill also helps to support public and private partnerships, again, at the local and district levels, to have comprehensive community health coalitions working specifically, intentionally at this health inequity. And we really want to drive some leadership. I think at the end of the presentation, we heard Dalmati talk about the leadership that's required within the African-American community, the Black and Brown community. We really want to drive meaningful leadership on this issue and connect it to other health inequities. And then we want to support the recruitment retention of public health workforce that includes folks within the Brown and Black community. So those are some of the things that this bill will do. We believe that this will improve the well-being of all Mainers. And I'll can take any questions, but I'll turn it over to you, Representative Mayer.
Sure. Thank you, Rachel. So my bill, LR 1006, simply ends the sale of all tobacco products, flavored tobacco products, no loopholes, no menthol or mint loopholes, and across the entire product line, including e-cigarettes. Happy to take questions. It's really that simple. Again, I have not seen the language still with the revisor. So if we've got any questions about the particulars of the bill, we do have some advocates here I've been working with who would be happy to answer those. We've been asked to share a little bit about how personally we became involved in these issues, in the issue of tobacco, particularly flavored tobacco. And I guess what I wanted to say is, you know, we've heard here from a panel of experts, and I thank each and every one of you, describe targeted marketing of a product that addicts, sickens, and kills. The tobacco industry's reach is particularly great in the digital space, where so many kids are looking for role models and beginning that journey into adolescence, navigating social hierarchies, trying to fit in, find that sense of identity. I saw this with my own son, who is native Hawaiian Chinese. Growing up, he was often the only beautiful little brown face among all of the other beautiful white faces in his classrooms. He was frequently reminded he was different, and that coupled with his coming out as gay as a teen made him particularly vulnerable to any messaging that might promise acceptance and relief, including the messaging that came with regard to menthol cigarettes. The social environment and the longing for close personal relationships are major influences on people, usually adolescents and teens, and they're told that smoking and vaping is a means to acceptance. People learn socially to become a smoker. It's part of a group membership, and it becomes an important part of people's identities. We know this, and so clearly does the tobacco industry. As parents, as grandparents, as members of our communities, as members of society, as members of the legislature, we have no tolerance whatsoever for predatory behavior of anyone, of any kind, coming into contact with our kids. Yet big tobacco has been lurking around our children right before our eyes for half a century, convincing them that their identity as a person of color included a menthol cigarette habit. And the numbers support that. The numbers support that their efforts have been, by their own standards, wildly successful, with the numbers addicted and sickened with chronic illnesses and killed. We have an opportunity here to stop this cycle and to save lives. And I do hope that our legislative colleagues will join us in support of these bills banning flavored tobacco products in Maine. With that,
I think, you know, Kate, I was just going to add, you know, that I heard Jet magazine mentioned a couple of times. And I will tell you that as a young Black girl growing up here in Portland, we had Jet and Ebony magazine sitting on the dining room table. We couldn't wait to get those magazines because it really was one of the only places that we saw ourselves. And, the advertisements validated us as young girls. I have 3 other sisters, no brothers. And that was really the only place that we would see ourselves, is through these magazines. And as has been noted, throughout the magazine is this, promotion of this product, of these products. And it was the coolest thing to do, is to be, to have this hanging, off from your fingertips. It signaled how cool you were back then, right? But I must say that unfortunately, it is I think Del Monte was talking about the generational impact, because I have a niece who now smokes, who's a chain smoker. So whatever messaging that worked before is still working. I have several young people in my family who are addicted to tobacco, and it is a racial equity, racial justice issue of our time. So yeah, I'm glad that we're talking about it.
Thank you both so much. I'm aware we're slightly over time, so I'm torn between being extra respectful of time and opening up for questions. So Botto and I sort of split that in half and say, if folks have to jump, we certainly understand that. But we have a lot of participants, which is wonderful. And I just want to open it up for questions. Do you have questions for any of the folks who presented? We have some other public health experts in Maine here to answer questions. Anything of our sponsors? What can we help you understand or answer a little bit better? Okay. And Carol, I'm not seeing any, which may be a function that people are feeling satiated with information, or it could be my technological inability. So let me just say this, as we're over time, there is a big team of folks working on this issue. If you have questions for Dr. Coates or Dr. Edwards, or Mr. Jefferson going forward, if you're thinking about some of this information and you want to dig a little bit deeper, please let us know. We're happy to help. Laura Harper and myself, any of the advocates here would be happy to get that from you. And you're going to hear this framing because it's very, very important when we go to the larger legislature and have this hearing. And let me just pause. So just a question from Representative Dudera. Thank you. She says, great presentation. Thank you. I'm out of the smoking loop. Are menthol flavored tobacco products available to buy online? And this online purchasing is a common question. I don't know if Hillary's here, but I might enlist her for an answer on this one.
So good afternoon. My name is Hillary Schneider. I'm the Maine Government Relations Director for the American Cancer Society Cancer Action Network. And I will tell you that Maine prohibits the sale of tobacco products via online sales. Our laws only allow for in-person sales of tobacco products. That doesn't mean that online sales have not happened, but they've happened illegally. And I will say that in the past year or so, the Attorney General's office in Maine has really proactively cracked down on this, and they've especially taken advantage of some of the changes in their work due to COVID, and after COVID hit, really focused on really identifying where online sales were still happening and cracking down on that. The other thing is at the federal level, there has also been action nationally to restrict online sales. So that will be happening across the United States, not just in Maine. So I will say that these products historically have been available when you can purchase online, but again, as I said, online sales are prohibited in Maine.
Thank you, Hillary. Okay. Thank everybody so much. Thank you for the extra few minutes. Representative Meyer, Representative Talbot Ross, our internal gratitude for your pushing this issue forward and allowing us to have the conversation. And to all of our presenters today, thank you so much. It's so nice to have your expertise and your personal experience sort of as we get ready to have this conversation with a larger group. So thanks to all of you, and enjoy your evening.
Thank you. Thank you.
Bye.
Thanks.
Thank you. Well done.